Thanks so much for listening to the Wild Health Podcast. Be sure to follow us on social at WildHealthMD and head over to wildhealth.com or wildhealth.com/premium to become a patient and experience precision medicine for yourself. Hey, Mike, how's it going?
Mike, what's up?
What's up with you? I am excited to talk about this today because ApoE4 carriers, we know a few of those. And this seems like a topic that's worth talking about. So you sent me this article last week on from Nutrients, and we're not going to go traditional journal club style and talk about the methods and the statistical analysis and anything like that. This is really more of a review article anyway, and not like a prospective study on humans with any sort of randomization or anything. But the title of the article is Precision Nutrition for Alzheimer's Prevention in ApoE4 Carriers. So pretty relevant stuff, and certainly something that comes up not infrequently with our patients. So talk to me, just get us started. What is the ApoE4 gene and how is it related to the risk of Alzheimer's disease?
Yeah, ApoE4 gene is it's a mutation of the ApoE gene that apolipoprotein stands for apolipoprotein E. And apolipoprotein E is basically involved with various types of metabolism of lipids in the body. There's three different types of mutations. There's, or three different types of the gene, I guess. There's an E2, an E3, and an E4. Majority of the population has E3s. Something around like 15-20% of the population has an E4. You can have up to two E4s. And then some smaller percentage has these E2 variants. Basically, the short of it is E4s have a higher risk of Alzheimer's disease. And that risk can range from anywhere from like threefold if you've got one E4 to like 12-fold if you have two E4s. So obviously 12-fold increased risk means like, that's a 90-95% risk of having Alzheimer's during your lifetime, which is huge for people who have two E4s. So something that we definitely need to pay attention to.
Yeah, and we talked maybe a month or two back about that interesting study on chronic traumatic encephalopathy with E4 carriers. So, we know this is relevant not just for, developing Alzheimer's when you're in your 80s or 90s, but that, even things like contact sports, and there's definitely a lot of implications to ApoE4. I think we can probably skip the deep dive into how the ApoE4 gene affects specific cell types in the brain. They go into that in detail in this perspective paper on microglia versus astrocytes versus pericytes. You think there's anything valuable worth summarizing there, or we can move on?
Yeah, I don't think we need to go into a lot of detail here. I think what's interesting about this paper, they do a really good job of sort of diving into the possible mechanisms of how E4 could be having this effect in the brain, right? And it basically comes down to a few things. It comes down to causing more inflammation, causing more oxidative stress, and insulin resistance, right? So that's sort of the main ways that it can be having these effects. And so they talk about a few cell lines. You mentioned that there's the microglia and the astrocytes, and basically those are two different types of cells in the brain. The microglia are associated with inflammation in the brain, and they sort of fight off diseases and things like that, like inflammatory cells would. Astrocytes are sort of these like protective cells that kind of like help feed the neurons as they're doing their neuronal stuff. So, you can imagine if those microglia cells get overactive, then now you're causing more inflammation in the brain, which is a bad thing, and we know leads to Alzheimer's disease. You can imagine if the astrocytes are having trouble, then they're not going to be able to feed the neurons as well, and now you've got a metabolic problem, right? And then there's another cell line called pericytes, which just sort of maintain the blood-brain barrier, which is this really challenging barrier to get through so that we don't allow all of the crap that's running around in our blood to get to our brain, which is a very sensitive organ, right? And as that blood-brain barrier gets broken down, that can then lead to Alzheimer's disease. So they do a really good job. If you're interested in this stuff, or cell lines in general, then you should definitely take a look at the paper and kind of, read through the possible different mechanisms of how ApoE could be affecting these different cell lines and then leading to Alzheimer's disease. But I thought it was worth reading through. But really, it comes down to the fact that ApoE4 patients have a higher risk of brain inflammation. They've got a higher risk of sort of isolated insulin resistance inside the brain itself. They've got more likely to have a breakdown of their blood-brain barrier, and are more at risk to negative aspects of oxidative stress. So basically, all of those things put you in the situation where, if you're living a hard life, it's gonna show up in an ApoE4 patient. Whereas, the E3 patients, they get away with a little bit more, right? Like they can push themselves with a little bit more stress. They don't have to worry about inflammation as much. They don't have to worry about insulin resistance as much. Where all of those things are going to be much more likely in a patient who has one E4, and then even more likely in a patient who has two E4s.
It's crazy how there's just in like the last 20 years, it's become this like final common pathway for all of the diseases you don't want to develop. Not that there's ones that you do want to develop, but all of these chronic diseases of Western society, like cardiovascular disease, diabetes, cancer, Alzheimer's disease, it's inflammation, metabolic dysfunction, and leaky XYZ, right? Whether it's a leaky gut or it's a leaky blood-brain barrier, or it's leaky endothelium in your coronary arteries. Like definitely some Occam's razor action going on here. All right,
they
cool.
mentioned
So
an interesting study, and so in this paper, Mike, they mentioned an interesting study where they took Southern Italians, and they looked at Southern Italians who had ApoE4s who lived in Southern Italy. And then they looked at Southern Italians who had ApoE4s and who lived in Western society in the United States, I think. And they found that the ones who lived in Southern Italy basically had the same life expectancy as E3s, as opposed to those who lived in the United States in Western society who had a much lower life expectancy than E3s. So basically showing that like lifestyle is the the final common denominator for like all of these disease processes, and especially for Alzheimer's disease and E4. And that's something that I try to tell my patients, in the setting of telling them that they've got an E4, is that this is determined by lifestyle. Like this is this is not definite. This is not the absolute outcome of what's going to happen to you. It totally depends on how you live your life. And if you live your life poorly, you make bad decisions, you have insulin resistance, you create inflammation, you create oxidative stress, you're going to have much more challenges fending off Alzheimer's disease. But if you live your life well and you reduce inflammation, you exercise, you reduce insulin resistance, all of those things, then you could potentially have the same risk as someone who has an E3.
Yeah, well, this is the whole, DNA is not your destiny, and the role of epigenetics and these other, pathophysiological processes going on around inflammation and endothelial dysfunction, et cetera, which is, you have control over this. That's what's so cool and empowering about it is okay. If anything, it could be a teachable moment, right? All right, I've got a genetically increased risk of developing Alzheimer's or cardiovascular disease, whatever the case may be, and now I'm motivated to move on and do the things that I know are going to mitigate that risk and get my risk as close back down to normal as possible. So good segue into precision nutrition, because there are, yes, exercise is going to help reduce your risk of cognitive decline over years, and there are other levers you can pull. But I think precision nutrition is a really fascinating one with regards to ApoE4. So give me the broad overview on precision nutrition.
Yeah. So precision nutrition, like as you mentioned, Mike, is really just the idea of applying nutrition principles to very specific, usually genetic and or lifestyle findings, right? So this person has an E4, therefore, what are we going to do in terms of your nutritional recommendations to reduce the risk of developing Alzheimer's disease? Or it could be with a different intention, like reducing your cardiovascular disease risk associated with an E4 or CTE or whatever. But this paper is talking specifically about Alzheimer's disease. So they make several recommendations about diet specifically, and then they make some recommendations about supplementation. I'll go over just sort of the basics here. in terms of diet, they recommend a few different kinds. They recommend either a low glycemic or a ketogenic diet, which is basically just to help reduce insulin resistance, right?
Sure.
They also recommend that because of ketogenic diet's going to have beta hydroxybutyrate. You're going to have that running through your blood. Beta hydroxybutyrate is the ketone body that is traveling through your blood, and you're using as a source of energy. It sort of offers an alternative food source to the brain, right? And helps reduce or help prevent any hyperinsulinemia in the brain itself. It also is anti-inflammatory. So the inflammation that we talked about from the ApoE4s, that's going to be reduced by a ketogenic diet as well. They also recommend a Mediterranean diet. So it's good that I like that they didn't just recommend one type of diet, because as we know, not everybody can do a ketogenic diet, for example. There are people who might have cardiovascular disease risk, for example, and high lipids, and they're also worried about the cardiovascular disease risk. So it's nice to have alternatives. They also recommend the Mediterranean diet. They actually cited a study that showed it reduced cognitive impairment by about 33%, eating the Mediterranean diet. And that probably has to do with, a few things. Mediterranean diet is really high in olive oil, which, as we both know, has lots of polyphenols in it. Those inhibit inflammation, which in this case protects the microglial cells. It also helps improve the blood-brain barrier, and can even help improve lipid metabolism in the astrocytes. So olive oil is great, and there's tons of it in the Mediterranean diet. You're also going to see a good bit of quercetin in the Mediterranean diet from red onions and capers. That's an antioxidant that decreases some of the inflammatory markers that lead to inflammation in those microglial and astrocytes. And then you're also going to see a decent amount of fish. Fish have DHA in them, right? DHA is a type of omega-3 that has been associated with lower risk with Alzheimer's disease. It's got anti-inflammatory properties as well. We also think that it has to do with improving cellular membranes, which probably helps the blood-brain barrier of patients who are at risk for Alzheimer's disease. So lots of advantages to the Mediterranean diet. I think clearly some advantages to the ketogenic diet as well in these patients. But obviously you're going to have to decide which one's best based on more than just whether they have an E4 or not. You got to take the rest of their health into consideration.
Can you confirm for me that the authors recommended avoiding alcohol essentially entirely in folks who have an E4?
Yeah. So they cite a couple of studies to make this recommendation. They also, they admit that there's data to suggest that, very moderate alcohol consumption, moderate meaning on the low end, it can be protective against Alzheimer's disease in patients with an E3. But the data that they cite for E4s shows that even like 1 to 2 drinks a month increases your risk of Alzheimer's disease if you have an E4. So, yep, it's a dry January, February, March, April, May, June, July. Yeah. They're not big fans.
Wow. All right.
Just clean it up.
So I was going to make a dad joke about that being sobering, but we'll move on instead to supplementation. Let's talk about some supplementation strategies that they mentioned.
Sorry.
I know I kind of made the dad joke even by trying not to make the dad joke.
It was a good one though. I really enjoyed it. It's a nice blend.
I appreciate that.
So supplementation. It's a similar approach to supplementation that I typically do with my patients. And that's if you can't get enough of what you need in your diet, then sure, supplementation makes sense. But ideally we get as much from the diet as we can. So they really talk about sort of the same things: DHA, quercetin, resveratrol, vitamin D, B vitamins, and then lithium are the ones that they mentioned. Let's talk about DHA first. So ideally you get the amount of DHA that you need from your diet rather than from pills. And there's a few reasons for that. Typically the pills that you take, fish oil pills or omega-3 pills, whatever they are, they're usually not phospholipid form, right? Phospholipid form is what you get if you're eating fish, right? And that is much more easily digested and can cross the blood-brain barrier. Whereas the triglyceride forms or the ester forms are not going to cross the blood-brain barrier. So while they might improve your whole body serum DHA levels, you're not actually improving your brain DHA levels unless you're getting phospholipid form. So because of that, they recommend krill if you're going to take a pill form of DHA, which I think makes sense. Most krill most krill pills are more likely to be in phospholipid form. but you still got to make sure you're getting a good quality, because some of them, might be degraded over time if they've been sitting on the shelf for too long, or if it's not high quality stuff. So I think the idea here is, if you can, if you don't have an aversion to fish, specifically those fish that have high levels of DHA and low levels of mercury, then I think it makes sense to also supplement with krill. And you're looking for, probably 2 to 4 grams a day of DHA, which is like, honestly, Mike, like a butt ton of DHA. It's like
It's a lot.
quite a bit. Yeah, it's a lot, right? Like you're talking about probably 4 cans of sardines or something like that. So really, if you're an E4 patient and you're trying to get upwards of 2 grams a day of DHA, you're almost going to have to supplement or just eat absolutely nothing but fish. And then your uric acid is going to be through the roof. So, yeah. Quercetin. Quercetin, you could potentially, if you were eating a ton of vegetables, you could potentially get enough quercetin. Remember, quercetin's that antioxidant that you find really in really high levels in like red onions and capers. It's also, fairly easily digested in a pill form, doesn't have a lot of side effects. So if money's not too much of an issue, I think supplementing with quercetin makes a lot of sense. It does have some anti-inflammatory properties. It came out as having some benefits against SARS-CoV-2. Also has shown up in the research as having some cardiovascular disease protection benefits. So I haven't seen a lot of negative side effects from quercetin. There's not a lot of GI upset. I don't hear of patients complaining about taking it for any particular reason. So as far as I can tell, pretty safe. Makes a lot of sense. Resveratrol. So resveratrol, we've talked about on the show before, is sort of the pill that you, or the antioxidant that you see in red wine, right? But in very low levels, and we're talking about high doses of resveratrol. David Sinclair takes, I think, 1 or 2 grams of resveratrol a day. I can't remember which one it is, but it's quite a bit. Resveratrol does a few things. It's got some anti-inflammatory properties, so it helps protect the blood-brain barrier. It's going to help reduce the activity of those microglial cells. And then it also activates PGC1 alpha, which we talked about on the podcast before, which is that it's that factor that increases mitochondrial biogenesis. And part of the theory of this paper and of many other papers is that Alzheimer's disease is a metabolic disease, and that basically the neurons are starving, and that leads to some of the damage caused by the neurons. Increasing mitochondrial density in those neurons and in those astrocytes is going to improve the ability of those neurons to get the food that they need to be healthy. So PGC1 alpha could be really beneficial. So resveratrol, pretty much have to supplement. You'd have to drink like a barrel of wine a day to get 1 to 2 grams of resveratrol. So
that's pretty tough if you're ApoE4 and you're not even supposed to have a drink once a month. I don't think you could do a barrel a day.
I don't think that's going to work out very well in your favor. So I would recommend supplementing with resveratrol. They also talk about vitamin D and B vitamins. I'm not going to get into this too much on this podcast because I feel like we talked about this a ton in the past, but basically vitamin D has some anti-inflammatory properties. Its hormone does like 10,000 different things in the body. Your levels shouldn't be low. If they are low, take some vitamin D or go out in the sun. It's my 5 seconds on vitamin D. B vitamins. The reason they're recommending B vitamins is mostly for improving homocysteine levels. There have been also some studies that suggest that DHA has a greater effect on reducing Alzheimer's disease risk if your B vitamins are also supplemented as well. So if you've got high levels of B vitamins. So definitely some benefit to make sure you're getting an adequate amount of B vitamins. Definitely thinking about that if you are vegetarian, for example. Vegetarians or vegans often have really low levels of B12. If you're on metformin, you're also going to have low levels of B12. So those people absolutely benefit probably for the majority of people with E4s taking B vitamins anyway.
Love it.
And then finally, they recommend lithium. Just to be honest with you, Mike, I'm not as sold on this one. The data is a little more sparse as to why lithium would be beneficial. There have been some studies that have shown reduced risk of Alzheimer's disease in patients who come from countries with higher trace levels of lithium in their water. I don't know if you've heard about this as well. There's also some like depression studies that have looked at this, where these people like in countries in Scandinavia where they have higher levels of lithium, they also have lower levels of depression. So lower levels of Alzheimer's disease, lower levels of depression. How much there is to this, I'm not sure is really causal. I'm really unsure about it. They're talking about really low levels of lithium, so we're not talking about therapeutic for about bipolar disease or anything like that. We're talking about like super low. So I'm not as quite sold on it, but if you want to read the paper and make your own decisions, go for it.
Yeah, I'm not going with lithium supplementation. I'm a big fan of pretty much everything else in that list, with an exception for resveratrol, because dang, that stuff is expensive.
It is kind of
So
expensive. Yeah, it's hard to find. I think it's just gotten popular is the issue. Like,
yeah,
I don't know, or maybe it's hard to keep stable. I'm not sure, but yeah, it is rather expensive.
yeah, and the one just one like subtle thing I want to throw in there is you can find phospholipid forms of fish oil that are not krill. So if for the folks out there like me who are shellfish allergic and aren't going with the krill fish oil supplementation, you can get by with you just need to find a good reliably sourced product that is in a phospholipid form. And then because a can of mackerel is about 1.4 grams of DHA. So if you're really in the 2 to 4 range, that is a whole lot of mackerel you need to be eating a day. And I agree with you, your eight's going to go through the roof. And then you'll
Yeah,
have your whole host of other issues. Maybe you won't get Alzheimer's, but you're going to have terrible gout. That's not going to make it your health span too outstanding. So supplement. If I think the short story is supplement if you've got an ApoE4, because you're probably not going to get those levels just through diet. Um, awesome. Well, I'll throw the a link to the paper for those who are interested. It's open access, so it's not like hidden behind a paywall. You can check out the whole review. We'll throw that in the show notes. And I appreciate you, Mike. This was great.
yeah. Thanks, Mike. Good to see you.
You too.
Hey everybody, a quick note about our precision medicine training program. It's been a really popular course. We're constantly hiring health coaches and physicians, but we're only hiring them as we grow if they're trained in precision medicine. You don't get that in medical school or other places. And so we've developed this training program and we've completely revamped it recently. It's a lot more robust. So now there's still over 50 hours of live synchronous training. There's also all the asynchronous credit, over 50 hours of content. And as a physician, you get about 50 hours of AMA Category 1 CME credit, which is a nice benefit. For the health coaches going through the training program, it's now accredited by the National Board of Health and Wellness Coaching. So graduates are going to meet the requirement to sit for the board exam and become board certified health coaches. So there's a lot of benefits to that, not just the certification, but also when it comes to things like insurance reimbursement. So it's a really robust program. If you're a physician, a nurse practitioner, a PA, or someone that just wants to be a health coach, it's open to all of those categories. There's the 6-month program that's kind of the full program. And then we also have just a fundamentals of precision medicine course, which is completely on your own. It's online. It's all asynchronous. You still get the 50 hours of AMA Category 1, but it's self-paced. And you still have access to the online community, but not all the synchronous lectures as well. So if you're interested in checking that out, go to wildhealth.com/education. And we'd love to have you as part of our next class.